Welcome, good morning, good afternoon, wherever you're joining us from across the European region, and welcome to all those connected to us through the live stream across this region. With this virtual briefing, the WHO Regional Office is reaching out to a wide community of non-state actors, non-governmental organizations, philanthropic organizations, academia, and the private sector, especially those with whom WHO has established long-standing relations and collaboration. Please all note that this stream today is available both in English and in Russian languages. This is particularly so that our NSA non-state actor colleagues in the eastern part of the region can follow this meeting. What we want to do today is give you a sense of how the WHO Regional Office, also in the context of the ongoing pandemic, is planning for the future. As you may know, the Regional Director, Dr. Hans Kluge, who I will hand the floor to shortly, has recently launched a consultation process on the European Programme of Work. And today is really about engaging non-state actors and hearing some of their reflections on this European Programme of Work, and to hear how they see themselves working alongside WHO and the partners in this region around this Programme of Work, United Action for Better Health. And we're looking forward to receiving your feedback. We'll be taking questions through this process, and I'm inviting you, please, those of you joining us, please submit your comments and questions through slido.com. Please use the hashtag NSA briefing. You can add your name and your organization. We would appreciate that so that I know who to send your questions to on our panel that's joining me here in the studio today. You can also support questions from other participants by giving them a thumbs up, and they will come to the top of the ranking in Slido. So if you see that somebody's asked a particularly good question, feel free to give them the thumbs up. We'll then prioritize that question because we will understand that there is a group behind it, not just an individual, which would be super. So thank you very much. And the Regional Director and his directors who are joining us here in the studio are standing ready to take those questions. So with that, let me quickly introduce the program. So as I said, I will hand over the floor shortly to the Regional Director, Dr. Hans Kluge, who will make a presentation and give us an update on United Action for Better Health, the European Programme of Work. We'll have some initial comments from non-state actors. I won't introduce the 8 that we have lined up to make short statements right now. I'll introduce them one by one so I'm cognizant of time, the time that we have with you today. And then we'll have a questions and answers session. And just to briefly give you an introduction to who we have in the room with regard to the panel, of course, we have our Regional Director, but he's also accompanied online by Dr. Natasha Azzopardi-Muscat, who's the Director for the Division of Country Health Policies and Systems. We also have here in the room with us Dr. Nino Berzulli, Director for the Division of Country Health Programs. Thank you, Nino. We have Ms. Oksana Dementi, who is joining us from Brussels online, who is the WHO representative to the European region. And also we have Dr. Dorit Nitsan, who's the Regional Emergencies Director. So my thanks to all of them. My name is Rob Butler. I'm the Executive Director in the Regional Director's Office, and I will be your moderator today and possibly even take a couple of questions if they're pertinent to my technical areas. So with that, I think we're there. Yes, I think it only remains for me to hand the floor to the Regional Director, Dr. Hans Kluge, to make an opening presentation. Regional Director.
Thank you, Rob. Just a small clarification. So, Ms. Dementi is the WHO representative to the European Union, based in our Brussels office. So, good morning, good afternoon, good evening to all of you, depending on the time zone. It's really for me a great pleasure to connect with you virtually. I had thought to meet many of you physically, but due to the situation we are in, at least we can connect virtually. And I'm particularly happy to welcome also the colleagues from the Russian-speaking countries which are connected. As Rob was telling, this is a moment where I would like to run you through the draft EPW, European Programme of Work, which sets the vision and the priorities and the flagship programs and the implementation modalities, how the WHO Regional Office for Europe would work in the region. And I plan to present this to the 53 member states 14 September this year at the Regional Committee. Let me start with a brief overview of the situation. I became the regional director the 2nd of February, and of course I had anticipated a different scenario. It was in fact more or less the time that the COVID really did its entry as well in the WHO European region, and that's why quickly I reprofiled the whole WHO Regional Office for Europe to assist the member states and the people of this huge region in the response to COVID. But repurposing also meant all hands on deck, not only for the COVID, but trying to keep the work running on the other essential programs. As of today, we have 2.5 million confirmed cases in the European region, or I should say confirmed patients. Tragically, over 190,000 people have lost their lives, and of course, each single life is one too much. So my deepest empathy to all the families and the communities who have lost beloved ones. Today, the European region accounts for 28% of the global burden and 41% of the deaths globally. For a very long time, we heard that Europe has been at the epicenter of this pandemic. And sometimes I'm hearing more and more, in fact, that the burden decrease in Europe. But of course, we're dealing with 53 member states in our region. And we are very, very active currently in a number of Eastern European countries and also non-EU West Balkan. So, as I always say in the media as well, complacency is our biggest enemy as of today. All our activities in the past few months have been underpinned by intensive briefings, knowledge exchange with policymakers in countries, and to strengthening the trust and the leadership capacity, as well as to foster evidence-informed responses to COVID-19. One of the proposed modalities I had put forward even before the COVID-19 was to work more and more on a sub-regional basis. As many of you know, I was the only candidate of all the candidates of the regional director who went to all 53 countries during what I call my campaign marathon, which gave a incredible rich information on what the countries think is working well by the WHO Regional Office for Europe and what is working less good and should be improved. And one of the things which came back time and again is indeed that we have such a diverse region. How do we work in a modus operandi which is relevant and useful for all countries? And hence that we went on with this sub-regional briefings and exchanges of knowledge. And time to time, whenever there is something very tangible to present, then we do not hesitate to convene the 53 countries, like, for example, was the case when we issued the policy options on how and when countries to transition out of restrictive public health measures. Let's come now to the EPW, the European Programme of Work. Why the EPW? It's called EPW. A clear call from the ministers of foreign affairs, in particularly when doing the campaign marathon, was that the countries don't want to see a WHO in Geneva and then a different WHO in Copenhagen. We know that Dr. Tedros, our WHO Director General, marshaled the GPW, the General Programme of Work, so the EPW is in support to the GPW, but obviously Europeanized. What came very clear during the campaign is the need for WHO to intensively collaborate with all the partners. Hence, again, my sincere appreciation for your time today. The EPW starts with the political mandate I got by and through the results of the elections around two main whys, two main goals. One is to leave no one behind, to close the gap between the countries and within the countries on health system performance and health inequities, including gender. So one, leaving no one behind. The second why, the second purpose, is to strengthen the leadership of the health authorities and to address the root causes of what I call societal erosion in public governance. And this was again set before the COVID-19, and I think we all agree that this has become even more factual during the COVID-19. Ultimately then, if we get over the acute phase of the pandemic, we will have to invest massively in recovery, resilient and robust health systems. So, the EPW, how to operationalize our vision. 2 whys, 3 whats, 4 flagships, and 3 hows. The mandate, the political mandate, starts from the imperative that the EPW would like to help the countries with the imperative of what is it that the citizens legitimately expect from their health authorities. So it doesn't start from a disease perspective, but from the perspective that what is it that the health citizens legitimately expect the whole health authorities to come forward with. Now I'm going through the 3 whats, the 3 core priorities. And as you see, they are closely linked to the triple billion goals in the GPW. The first core priority, the first what, is moving towards universal health coverage. And we know that in our region, this has a lot to do with the financial protection, that people are more and more being pushed into the poverty, not at least as outpatients with the need for drugs and medicines to manage chronic diseases. 1, UHC. The second one is to protect against health emergencies and preparedness. Again, this was said before the COVID-19, but became even more relevant. And the third what, the third core priority, is about promoting health and well-being, the big field of health in all policies, of disease prevention, health promotion, where traditionally our region has been quite avant-garde globally. So now I will try to unpack this a bit. The WHO Eurovision on the 3 priorities. Again, it starts from the imperative, what do the citizens expect from their health authorities? So, the first priority, citizens expect access to care without being pushed into poverty. It's about the financial protection, people-centered services, human resources for health, sustainable workforce, access to affordable, innovative medicines, and the governance. Under the first priority, I've put 2 flagships, 2 out of 4. What is a flagship? A flagship basically came out of my campaign tour, was requested by the health authorities and the foreign affairs. It doesn't mean that the other technical programs are not important, but they do have societal consequences and are hot topics by the countries, and will also require from the region director himself additional support. So 1, a coalition for mental health. It's a leading cause of disability and suffering in the European region, and we see worrying emerging trends. Again, this was before the COVID-19 was doing its large entry in the European region, and we are very worried that now, particularly due to the COVID, this will have long-lasting, devastating impacts. We foresee a broad mental health coalition, and there again, I acknowledge in all modesty that many of your organizations have doing a lot of work, so I'm reaching out here. It's to mobilize opinion makers and champions. A champion who has expressed already interest is the Queen of all Belgians, Queen Mathilde, who is a SDG advocate for mental health. We would like to review successes, failures and perspective, and to support national policy dialogues. A second flagship project which is put under the first priority of universal health coverage is digital health and innovation. Yesterday we had a weekly press briefing and the main topic was digital health, where I was telling digital health is about empowering people and leaving no one behind. We are already in a advanced stage of a European roadmap for digitalization of health system, which in due time will go out also for consultation. We have the ambition to develop consultatively a charter of European values and principles for health data access, management, governance and use. We know very well that there are so many big players in this field, but we believe that the whole issue of trust and governance is really a comparative advantage of WHO. And then to digitalize, to improve the interface between citizens and services. So the first priority is UHC. The second priority is citizens expect to be protected. We need to learn from the COVID. Already we are starting what I call a intra-action review. So WHO has the obligation to do a after-action review, but we don't wait, we go forward because the next 6 to 9 months will be very critical looking towards the fall when COVID may meet influenza, pneumonia and other ones, so we have to be prepared. And again, to work through regional and sub-regional modalities and fostering the solidarity. Yesterday we had a meeting with the Minister of Health of the small countries, and a number of lessons learned which came forward by the ministers was that there is a need for structures on how to work together in peacetime. So when the wartime comes, like we have been thrown into the wartime, that then automatically those structures are being activated. And several ministers felt that this was not in place, whether in the EU or outside of the EU. The third core priority is that citizens expect to live in healthy communities. The vision being a European culture of health, that everyone in our European region is empowered, is enabled to make healthy lifestyle choices. This is a big paradigm shift to promote health and well-being, and I'm a big fan of the concept of the economy of well-being, which came out of the Finnish EU presidency, also very visionary, because in that vision, just like we say in the COVID transition now, we should not pitch health against economy. It's an economy of well-being, which puts the people into the center, and it also deals with a huge unfinished agenda of communicable diseases. We are the region where we have multi-drug resistant tuberculosis as a hotspot, where HIV is still on the rise and the need for evidence-informed national policies, AMR, antimicrobial resistance, and other infectious diseases threat. Under this third priority, we also put two flagships. One is the Immunization Agenda 2030. Again, this was put based on my campaign marathon before the COVID and becomes even more important. We have seen in about 1/3 of our member states a disruption, quite a substantial disruption of routine immunization services. If we're looking forward to the fall and to a potential second wave, one of the things which work, and we do know, are vaccines save lives. So to scale up coverage of vaccination of seasonal flu and other ones. We need to have political will, accessible supply, and equity in access across the region. So to address inequity in access, this is a biggie, really a biggie if you look to COVID-19 vaccines. right? There are many, many initiatives, but are we going to see the same like happened with the masks in the beginning of the pandemic? No, with vaccines. So that's also why our office started to work already on a allocation framework for fair and reciprocal distribution of the COVID-19 vaccines. The fourth flagship is leveraging behavioral and cultural insights for health. People may know what is a healthy lifestyle decision, but still not behave accordingly. So my belief is that we should not, this is not a moment to blame people and to pinpoint if there's an anti-vaccination movement. If people are not adhering to physical distancing measures to temper the COVID-19, let's try to understand why are the people in fatigue to those measures? Why don't they want to be vaccinated? And a number of countries have done this very successfully. We were the first ones to develop and issue guidelines on behavioral insights on COVID-19, and 30 countries are applying this, and a number of countries also outside of the WHO European region. We want to support countries to adapt, adopt, and improve practices that make it easier for people to make the optimal choices. At the same time, we are also committed to build upon the work done on health literacy that in a number of our countries, people don't know what is the best for a healthy lifestyle choice. So one does not include the other, and the inequities will always be at the center. I have now taken you through the political imperative. What do the citizens legitimately expect from the health authorities? The issue of the trust. Then I came to the two whys, leaving no one behind, empowering health leadership. I went to the three priorities, the three whats: universal health coverage, emergency preparedness, and tackling emergencies. And then I'm very obliged to Turkey. I had another conversation with the Director General of the Ministry of Health of Turkey. Turkey, in no speed since I became regional director, got approval from the parliament for a new center of excellence, we call it the GDO, on emergency preparedness in Istanbul. Turkey will be my first country visit since the COVID-19, the week after next week, and also to sign the financial agreement with the government on that very important center. The third what? Health and well-being. 4 flagships: mental health, digital health, immunization 2030, behavioral insight. Now I come to the most important, the how. If I have to summarize the whole EPW into one word, I would say how. Countries are telling me time and again, WHO can no longer stop by providing policy recommendations. It needs to be very active on exchange of practical know-how to help countries how to pull off the what's. It's all about maximizing country impact. My geopolitical priority is Central Asia, the 5 Central Asian republics, and the non-EU countries. We leave no one behind, we're active everywhere, but this is a time of focusing. And the focus is on the eastern part of this country. I am very, very grateful for all the partnerships we have, which will allow me to do so. So 3 hows. The first how, uniting efforts of regional and global partners. As many of you know, I have been working in some of the most challenging places in the world. In the prisons for 2 years in Siberia, with tuberculosis control, with Médecins Sans Frontières, MSF. I know the importance of NSAs. I have been working 5 years in Myanmar under the military regime. I have been working in North Korea. I have seen what I call the power of positive partnership. So that's why we need all of you on board and beyond, but look at what I call fair and transparent criteria for partnerships. Everyone has a comparative advantage, every one of us, and we have to acknowledge this. I'm very, very grateful to the European Commission for a tremendous support in the COVID-19, to the mandate of WHO. Yesterday I was with Dr. Tedros in the European Parliament, in the ENVI committee, but also with my relationship I established with Commissioner Stella Kyriakides, who I really would like to express appreciation, and all her team, Anne Boucher, Next week, the 2nd of July, we have a full hour with the Commissioner, Ms. Anne Boucher, on exploring synergies between the EPW and the EU for Health program. Similar relationship with Commissioner Oliver Varhelyi, we have a huge project in the 6 Eastern Partnership countries in the Western Balkan, but particularly I would like to beef up and explore the partnership in Eastern Europe. Next week, Tuesday, I will be among the Ministers of Health of the Council of the newly independent states, Soviet SNG, the Eurasian Economic Union, the Shanghai Cooperation, the BRICS, the Organization of Islamic Countries, the non-aligned movement. Tremendous potential. So let's not duplicate and explore. Number one, partnership. I'm a strong believer. So please help me on that one to implement the EPW. Second one, direct support to the health leadership in the countries. The single most important thing I decided myself when taking personal leadership of the COVID-19 in this region was to maintain literally day and night direct contact with the countries. And we have done so and will continue to do so. Now we'll help the countries to support negotiation of recovery. I reactivated also the Club of Ministers of Finance to help the countries to position health further in the recovery agenda. We had 4 video conferences with Professor Mario Monti, who used to be a commissioner, who used to be Prime Minister of Italy, also to help us, with Sir Suma Chakrabarti of the European Bank of Reconstruction and Development, to shape the dialogue to the financial decision makers. In that sense, we're also in an advanced stage to present to the Region Committee in September the WHO European Academy on Transformational Leadership. It has 3 legs. The first leg is a junior fellowship program to invite junior fellows from Eastern Europe, from the Balkan, to spend 1 year, a full year with us, and to have some theoretical training on governance, public health leadership in Copenhagen, and then send them out to country offices or our GDOs. Number one. The second leg is for mid-level, for example, directors of International Health Department, to spend 6 months here in Copenhagen itself. And the staff will learn more how a national administration works, and then the people go back to their country and understand better how WHO works, a multilateral agency. The third year is for the top level of policymakers, ministers, deputy ministers, chief medical officers, on the how, on the transformation of health system, an active exchange and twinning between high-level policymakers. First, how partnership. Second, how direct support to health leadership in countries. And please, all colleagues from NSAs, reach out to our 31 country offices. Third, how a regional office fit for purpose. I strongly believe that WHO has to be a mirror to the member state. How can we go to the countries and advocate for digital health if this office is a paper-based organization? My director of business operations is working to digitalize this office within the next 6 months and simplify 6 major business operations which came out of a consultative process of my staff. This is a tremendous opportunity to update the country cooperation strategies we would like to have with all 50 countries post-COVID. The single biggest thing I would like to do in the office here is to pursue an agile transformation. What does it mean? Agile transformation means a wholly customer-centric approach, which means member state-driven. Always thinking, will it make a difference at the country level? And second, to cut time to delivery to the countries. For this, we are working on different modalities. We respect diversity. A lot of hotspots on harassment we have to kill, and I'm very determined. Zero tolerance to the harassment, including sexual harassment. Niche expertise. We cannot do everything. What is our niche expertise? And learning from the COVID-19. I'm already in the process to reverse, particularly in the EU, international WHO representative positions to national head of country offices. Why do we need international WRs in a number of EU countries, particularly the smaller ones, including the Baltic states? But let's beef up our country offices in Central Asia, in a number of Eastern European countries, in a number of countries if need be, EU or non-EU West Balkan, where we can make a big impact. With this, I'm coming to the end of the presentation to make really also salute all my staff. I'm very proud of the staff. We have very, very good people. We need to further go on with staff development and learning. As I say, I cannot guarantee in this time lifelong employment, but I'm very determined to provide to my staff lifelong employability. And our people at the front line really are continuing to work day and night, and please reach out to them. Finally, the real frontline workers, right? Keeping us and our loved ones safe and fighting the pandemic. This has been the heroes really of the COVID-19 response. In the beginning, also sometimes without PPE, which is a very big lesson we have to learn, but we must equip them with the knowledge and the tools also to be fit for purpose and to do what I try to do for the staff, also to take care of mental health and well-being. If we don't take care of ourselves and our staff, then we cannot serve the people and the patients. It's a special year. 2020 is the year of the nurse and the midwife. Many of you know that I'm a great advocate for nursing and midwives, and I'm also keeping my campaign commitment to recruit a chief nursing and midwifery officer, because they are dealing with the biggest workforce in the region. Thank you, every one of you, all your colleagues, for a great job during the COVID, and I'm really looking forward to some very friendly but straightforward criticism to improve the document, and particularly the how. How can we work together towards leaving no one behind? Thank you.
Thank you very much, Regional Director, and a very clear ask of you all. Please engage and give us your feedback. And on that note, also I'm promoting, of course, that you send us your questions in Slido. If we don't get to your questions because we've run out of time today, we will respond in writing. So now I'm going to move to some initial comments from non-state actors accredited by the WHO Regional Committee for Europe. We have a series of speakers. I will ask the speakers or remind them that please no longer than 3 minutes per intervention. And I will then take your questions, any questions you pose, and pose them to the panel. I might take a number of statements first before we go to answering those questions. So in this case, I will invite Mr. Marco Greco, who's the president of the European Patients Forum, EPF, to take the floor. Mr. Greco.
Thank you. Thank you for this opportunity on behalf of the European Patient Forum. I want really to thank you, to thank the WHO Europe for this initial opportunity to comment. We welcome this timely draft program, in particular because it is indeed ambitious, and this gives us a space for cooperating. It's easier to cooperate and to support a program if it is ambitious rather than if it is conservative. The program that we have seen this morning addresses several important issues, and particularly the determination we have noted to leave no one behind is a critical commitment for us, and we welcome that. Since the beginning of the COVID-19 crisis, APF has naturally engaged actively with its member, trying to monitor the situation while highlighting our members' concern and providing information updates to our community. It is clear from these exchanges that COVID-19 has exposed more than ever gaps and weaknesses in the health systems that the patient community has long been aware of and has denounced before. The main challenge and concern for patients during this pandemic has been health system capacity to provide continued access to high quality and person-centered care. Because, you know, people with chronic diseases are very vulnerable during pandemic, not only directly from COVID-19 per se, but also because of the disruption or the delays in diagnosis or treatment, the social distancing measures, and also the post-pandemic phase, the economic one that affects more than the others, people with a chronic disability. The pandemic so far has highlighted the need to build a stronger health system that can provide care to all under all circumstances. So that's why I would like to recall our roadmap for achieving universal health coverage by 2030 that urges EU institutions, member states, and the healthcare industry to ensure the delivery of affordable healthcare for all, recognizing that patients everywhere in Europe, regardless of which country they live in or their country of origin, have and must have the right to equitable and timely access to high-quality care. In line with WHO Europe, APF believes that an important paradigm shift is required to reach universal health coverage and the targets. In aftermath of COVID-19, political attention and will to strengthen healthcare system and workforces has never been higher and should be taken as an opportunity. These will need to include the identifying and addressing the gaps in universal coverage and the inequalities from the patient perspective, as well as person of people-centered care. APF is fully committed to that, and we are here for supporting WHO Europe activity if in this direction. APF also highly supports the flagship initiative Empowerment Through Digital Health as presented in the program of work. I would like to take this opportunity in the last seconds of my intervention to highlight that patients' involvement to achieve real empowerment and participation is key, is essential, is central. Meaningful patient involvement is an underused resource with real potential for improving the effectiveness, efficiency, and long-term sustainability of healthcare system and programs of reform. We started a debate this year in our Congress in the last 12 months, and we plan to go on in this direction. Health system digital transformation is already happening, but we believe that in order to bring real value, Europe's future digital health tools and systems should start from patients' priorities and be co-developed with patients. Digital health is an area where co-design is not yet well developed as it should. Health system responses to crises have in some locations already resulted in changes, such as virtual consultation, patients and professionals using online tools. This, however, is not yet the norm, and too few patients with chronic condition are benefiting from this. The flagship initiative on empowerment through digital health has the potential to support a people and personal-centered digital transformation. We are, as APF, looking forward to this and how we see the role of patients' organization in detail in our written response to the European Programme of Work is made clear. Thank you for your attention.
Thank you very much, Mr. Greco. I'm going to move straight on, and then I'm going to hand over to the panel in a moment. Can we next go to Mr. Frick Spinavin, who's the president of the European Public Health Alliance?
Yes, thank you. Do you hear me?
We do. Please go ahead.
Okay, thank you. Dear Mr. Kluge, dear colleagues, good morning, first of all, from Belgium. I'm speaking on behalf of IFA's diverse membership, which covers a large part of the Europe region. Thank you for giving us the opportunity to provide some feedback on the European Programme of Work of the WHO Europe. We are impressed with the Programme of Work, and we like the interconnection between the three core principles, which is highly relevant in the aftermath of the COVID-19 crisis. We're particularly pleased to see a strong push towards achieving universal health coverage, including via increased collaboration between the health and the social care sectors. Now more than ever, it is vital to ensure adequate funding for strengthening health systems, and it is even more imperative to safeguard that funding will be used in the most effective way possible. Equally important to us is the determination to leave no one behind. The pandemic has exposed the weakness health systems across Europe have grappled with over many years, including the negative consequences of social disinvestment. Over the last months, we have witnessed an exacerbation of already existing and growing health and social inequalities between and within countries in the region, and these need to be tackled. 2 days ago, we had the opportunity to provide the WHO with concrete inputs from IFA membership and partners on the impact of the pandemic, specifically on vulnerable groups. To me, this meeting demonstrated the crucial role of civil society to bring the voices of citizens to policymakers. We hope that such exchanges of views will help the WHO to address the real needs and problems of underserved groups and to take into account nuances and intersections between different issues. In terms of providing implementation support for the program of work, IFA's diverse membership covering disease and issue-specific organizations, healthcare professionals, services for vulnerable groups, and public health specialists mean that we can offer expertise on many topics. We cover issues such as health inequalities, NCD prevention, healthy living environments, access to medicine, digitalization, and air pollution. We are keen to collaborate with you on these topics and to mobilize our European national, subnational members to establish synergies between your core priorities and help build capacity for health system strengthening. The components of the first core priority are key to making progress on health inequalities, with notably the breaking down of the barriers between health and social care, ensuring a fairer distribution of health workers across the region, and working towards a new social contract to ensure access to medicine and supplies as important actions. Even more important will be the reprioritization of government budgets to meet health objectives and the ring-fencing of health and social care budgets. The two flagship initiatives, namely the creation of a mental health coalition and providing empowerment through digital health, are welcome levers for moving forward towards universal health coverage. For far too long, mental health has been disregarded as a serious public health issue. Given the new push for digitalization triggered by physical distancing measures, IFA appreciates World Health Organization's inclusive vision for digital transformation in health and care. In the current debate about digital surveillance and track and trace apps, the right ethical balance must be found between having better quality data available for public health and protecting people's privacy and rights, something we have recently highlighted together with UFA. And finally, we agree it is important to develop robust metrics and indices on health and well-being. The prospect of convening multi-stakeholder national policy dialogues on inequalities is promising, including on the health and well-being of underserved groups. You can count IFA as a key partner. Thank you.
Thank you both very much. So at this point, I'm just going to go quickly over to Dr. Natasha Azzopardi-Muscat, because there were points made here on patients' participation in care. And I understand also from Slido that we're getting a lot of votes. The most voted question so far, which is how we can support the European health professions education at this difficult time to assure the highest quality of so needed health workforce. Natasha, can I ask you to make a couple of comments to those two at this point before we go to the next speaker? Just very shortly, please.
Thank you very much, Rob. Thank you to European Patients Forum and to IFA. I think the points that you have made are very, very relevant, and they fill us with courage that we will have strong NSA partners to work with going forward. I think one of the critical things that we have noticed during COVID is that some essential services have been left behind. The WHO has done important work in this area. It's going to take all hands on deck to recoup what we have lost, but furthermore to ensure that in the case of resurgence of the pandemic, we do not slip through a second time. For this reason, what we are promoting very much as WHO is this dual track health service. On the one hand, we need to keep an eye on COVID. On the other hand, we need to make sure that our routine health services are strengthened and continue to go forward. Of course, all of this has an impact predominantly also on the workforce. And we need to keep the mental and psychosocial support for the workforce very much at the center and at the forefront. Educating our health workforce is a priority, and we keep doing this also through the resources that WHO is providing during this emerging and uncertain period. And finally, I'd just like to touch briefly on patient involvement and digital transformation. During the past few weeks, we have seen digital transformation at pace and scale that none of us could have ever imagined before. this is the time to really take stock and see what potential lessons we can learn to improve access, to improve even the ability for patients to be better served and really to have the services that revolve around people, to evaluate therefore what is good to retain from the crisis going forward, what needs to be strengthened, and to learn whether there have been any groups that have been left behind. Going forward, the Country Health Policies and Systems Division does present an opportunity for us to combine very much the health services and the paradigm shift we need to bring about in health services to truly ensure that we do have high levels of universal health coverage across the European region. We know that there are still gaps and pockets, both regionally but also in terms of populations, but combining very much this with the social and upstream determinants of health come together. It is only in this way that we will truly be able to work towards universal health coverage. Thank you.
Thank you very much, Natasha. Right, I move immediately on to Miss Caroline Costongs, who's Director for EuroHealthNet. Caroline, please go ahead.
Yes, thanks a lot to you and to WHO Europe, and particularly to the Regional Director, Hans Kluge, for this meeting, this initiative. And I would like to congratulate you to already liaise with non-state actors and other organizations in such early development stages. And we also welcome the European Programme of Work. And I would like to make 3 points on behalf of the Executive Board of EuroHealthNet. First point is the need to work with other sectors. Second is to investing in the social side of crisis preparedness. And third is the efforts to strengthen health promotion. So for the first point, we very much welcome your focus on leaving no one behind. Health inequalities were rising even before COVID-19. We remember all of the yellow vest movements that we've seen, and we know that COVID-19 will not have made their situation much better. So we need a dedicated approach to address health and well-being of them. It's about working more closely with the social sector, on poverty, on addressing unemployment, inequalities in education, in environment, and so on. So we need the support of the WHO to encourage action on these seeds, the socio-economic and environmental determinants of health. And EuroHealthNet is very keen to help you implementing this. My second point is related to finance. The scale of investments that is needed is huge. We have seen a large mobilization for funds towards crisis preparedness. It mainly to help equip health professionals and hospitals and increasing medical capacity, which is very important, but it's very much following a biomedical approach. We should also need to finance preparedness through a more psychosocial model. It's investing in resilience, in mental health, as well as your flagship initiatives, social support. And I'm quite proud to say now that today we launched an e-guide on financing these sort of upstream approaches to health. And we developed this guide in the context of the WHO coalition of partners. And I really hope that we can continue to work with the WHO to bring in the finance sector, and particularly how we can do that, and providing the instruments and tools. My third point is related to the flagship initiative on healthier choices and behavioral insights. It's an important approach for sure, but it has a risk that we drift to lifestyle-based approaches. Making a healthy choice is a luxury, and many groups have no choice. So we need to create opportunity to work on the capability of people and to address the commercial determinants of health. So generally, I know it's there, but we want to see even a more prominent giving to the various health promotion approaches that are out there and efforts to strengthen those. And again, EuroHealthNet is very keen to help. So in short, EuroHealthNet very much endorses the program, but we would like to call on the WHO to provide further guidance on working with other sectors, on investing in more the upstream factors related to crisis preparedness, and in strengthening health promotion approaches. And I was wondering how you would see that further featuring in your program. So thanks a lot for this opportunity.
Thank you very much, Ms. Gostongs, and we will come back to those questions and prompts in a while. Just bear with us, because we're going to move straight on now to Mr. Maciej Juzacic, excuse me if I'm mispronouncing your name, to speak to us. He's the incoming Secretary General, Age Platform Europe. Mr. Kukacic?
Yes, can you hear me?
Yes, we can.
Yes.
Please go ahead. And may I before you go ahead, can I just ask all speakers, please do, of course, adhere to the 3 minutes, but please try and speak slowly as well. But we're cognizant, of course, we have our interpreters are trying to keep up with us. So please keep the pace slow. Thank you very much.
Okay, thank you very much. Thank you for inviting us to this briefing on behalf of Age Platform Europe. We are a pan-European network of non-profit organizations representing both self-advocates, persons aged 50 plus, but also organizations providing services for older persons. We have been, over the last years, supporting WHO Europe and the European countries to achieve the highest attainable level of health, leaving no one with this objective of leaving no one behind. So therefore, of course, we are extremely interested in the upcoming steps. We welcome this European program of work. And here I would like, in a very concise way, to give you, to underline the following aging-related aspects for further consideration in the implementation of the program. So first of all, on the core priority, on the first one, I would like to say that this is obviously access to universal health coverage is in particular crucial for those living on minimum income or older persons experiencing poverty. For many of them, actually, the access in particular to health and long-term care is becoming a challenge. This is because the income of many older persons is being eroded as they get older. And of course, the long-term care, as a very labor-intensive and therefore costly service, this expense now is, let's say, presents even a big burden for people themselves, because most often they have to cover it with their own, well, out of their own pockets. On the core priority 2, protecting against health emergencies, here we pledge to pay attention to social services, which from the perspective of our members are as equal, as vital as health services. The COVID-19 shed a new light on this situation, so we consider that in your program, both health and social services, they should receive the same attention, with the objective to be provided in continuity, both in residential facilities, but also at home where older people live. On the priority to promote health and well-being, we are absolutely in line with your objective to increase investment in health promotion and health environments across the whole lifespan. So here, this should go hand in hand with the objective of tackling health inequalities. And of course, we encourage as much as possible further collaboration between the existing networks at European and global level. So here I think namely about the European Healthy Cities Network, but also the global network of age-friendly cities and communities. So how we would like to contribute to the implementation of this program, of course, we will keep bringing on board the voice of older persons. In particular, we would like to share our experiences on ageism, on the promotion of age-friendly environments, but also, as I said, the specific focus on the long-term care and the needs in this area. We would also like and encourage you to build bridges with other relevant EU policy developments and tools. We've got an upcoming green paper on aging coming from the European Commission, but we've got also the relevant principles of the European Pillar of Social Rights. But we also would like to support liaising with relevant stakeholders including the Council of Europe, but also other UN agencies. I think here in particular about the Madrid International Plan for Action on Aging. So to conclude my question, if I may have one, considering that the WHO is about to launch a decade on healthy aging, and considering the long-standing experience of Europe in relation to aging, we would like to know what role do you see for the regional office in the implementation of this decade? For example, could WH Europe use it to raise the health profile of older persons, for example, by ensuring a holistic and coordinated approach to long-term care based on well-being, autonomy, independence, and community inclusion of older persons? Thank you very much for your attention.
Thank you very much indeed, Mr. Kujazic. Very much appreciate that intervention. I'm going to move straight on, and then I'm going to come to the panel with a series of questions that I've taken down here. So please be aware that the next statement by Ms. Zakisova from the European Forum of National Nursing and Midwifery Associations will be made in Russian, so you will need your headsets, those of you following in English. Thank you very much. So I hand the floor to Ms. Zakisova to make a statement. Thank you.
Distinguished Chair and colleagues, we appreciate the opportunity to speak on the draft of the European Programme of Work. We welcome and support the document. Unfortunately, there is no sound. Early this year, the International Year of the Nurse and Midwife, WHO launched the first State of the World Nursing Report with recommendations to member states, which are crucial to achieving universal health coverage. WHO also identified the recommendations to the member states. We believe the WHO Euro should have the mission on the implementation of the recommendations in the European region. And we urge the WHO to see whether it is somehow related to the role of nurses and midwives in assisting people with NCDs. We believe that the models of care which engage nurses and midwives increase the quality of healthcare and improve treatment outcomes and quality of care with low cost. COVID-19 pandemic has enlightened multiple issues. Urgent actions were implemented to attract retired nurses to overcome nurse shortages. Those working in the field faced extraordinary workloads. The crisis showed the need to proper investments in preparation of young nurses. COVID-19 wrote a new page in regard to leadership. Many countries of the region are lacking leadership programs for the nurses. Nurses are seldom participate in decision-making on health care at all levels, from the local clinics and hospitals to the governments. With COVID-19 pandemic, we face situations where practicing nurses were given more medical tasks to fulfill. And the leading nurses were at times to lead the whole hospitals. This is a big lesson for the future, to give nurses and midwives larger clinical authorities. They should have the voice, and they should be supported in the leadership training programs. They should have the positions in the healthcare system. WHO Euro need to demonstrate its support to member states by establishing of the post of Chief Nursing and Midwifery Officer. And we are very glad that Hans Kluge supported this idea. We are very, very glad to hear that. Thank you for your attention.
I've got a series of questions now ahead of us from the speakers that have just run. So I'm going to start with, excuse me just a moment. I'm going to start with Mr. Kucharczyk, and I'm going to go over to Dorit Nitsan and then Natasha Muscat to respond to the questions around the decade of healthy aging and health and social services connections.
Thank you. Thank you very much, Rob, and thank you for this question. Indeed, COVID-19 brought the life course specifics into this stage, and we are focusing on the different needs of the young and elder or senior people around the world. What we see, and I think you touched the really important points, is those that are staying in the margins and behind, elderly with poverty, with eroded income and inability to fund or support their care, especially now when many of them had to be at home or closed in the different settings where they are staying with. So these people now are us. And what we are trying to do is to put them at the center, to work together with the social services, the welfare services, and the local communities together. And here we really depend on you, with the non-state actors, with NGOs and local communities. Volunteers are welcomed in many societies now, those who are visiting the elderly, providing them with food, with medicines, with care, attention, not to leave them alone during these times. Home care became also another topic that we are focusing now. And of course, we always say that emergencies are crises, but we want to see the light and to work together with the rest of us, those who are working on sustainable and long-term development, to ensure that what we are learning now and what we are doing to learn what is good and what is not so good, and to implement it better in the future. So all in all, let's join hands even further and work strongly in that area. Thank you.
Okay, thanks very much. Natasha, very briefly, please, because I'm cognizant of the time.
Rob, I think Dorit has really covered everything. So just to emphasize that, of course, this crisis has taught us that although the elderly are at risk, the risk increases when they are unwell. So as much as possible, we need to keep working to keep people healthy for longer. And secondly, when elderly people come into contact with hospitals, with nursing homes, there are certain risks for them too. And just to emphasize the need as far as possible to bring care to the elderly for wherever this is a feasible solution, whether it is through digital means or through human means, also tying intervention, the huge role that nurses have played in these institutions for the elderly and in the domiciliary provision of care and support, together with the social care services. Over.
Thank you. That links us nicely into Ms. Sarkisova's prompt regarding the role of nursing and midwives and their absolute value. Maybe I can turn to the regional director to say a few words on that. Thank you.
Здравствуйте, глубоко уважаемая Валентина Саркисова. Как я рад вас слушать.
Dear distinguished Ms. Sarkisova, I was so glad to hear you. First and foremost, I congratulate you on such prominent work. I agree with all your comments, and I would like you to ask to send me your concrete suggestions. We will find a chief nurse special here at WHO Europe. Thank you. Once again, let's work together. Thank you very much.
And to Director Kostongs, thanks very much for this question. You do point out that we need to articulate possibly this flagship a little better because, of course, it's not about choice. It's not all about choice. And when we talk about insights, we're really talking about facilitating people-centered policies, services, and adoption of healthy lifestyles. But this flagship is all about listening. This flagship is all about valuing communities, valuing the subjective experience that individuals have with their health services. And that's why it's a flagship, of the European Programme of Work, because this is about a shift towards meeting the needs and the preferences of those communities with our healthcare services, tailoring to their needs, making sure that we're listening, adapting to those needs. So I wanted to say that before handing the floor to Dr. Nino Berzulli to say a few words around health promotion, which was also the point from Director Costong's previously. Thank you.
Thank you so much. And I would like also to reflect on the question about addressing social, economic, and environmental determinants as very, very important in our contributor. In the EPW, under the core priority 3, promoting health and the well-being, specific attention is given to mitigating the impact of the poverty and inequities, on ill health and the social cohesion. So we can't do this without the strong policies for social protection, for gender equality, for safe and secure living conditions and a healthy environment. So EPW brings all these aspects together and provides the opportunities to increase the synergies in these policies. And on the flagships, and particularly addressing the health promotion and the prevention aspects, the behavioral insights, and that which Rob already talked about, and the digital health will be used to support the design of the policies and the interventions to promote the risk factors prevention and the health promotion. So clearly there is a need to shift the health service delivery systems and the financing towards the health promotion and integrating health promoting services. And we do have very good examples, the best practices in European region in terms of providing funding for health promotion using the fiscal measures. In the EPW, we will strengthen the multi-sectoral policies, multi-sectoral action, and engaging the partners beyond the health, engaging the finance sector, engaging the private sector in order to be able to promote investment in the health promotion as well as for the healthier and more sustainable society. And the European Academy on Transformational Leadership that Regional Director mentioned, of course, provides a very good opportunity for us to bring the other players in the finance sector and the multi-sectoral partners to be advocates, for the health promotion and the prevention. Thank you.
Thank you very much, Nino. Right, we have 3 NSA representatives still to speak, so we're getting pressed for time. I urge you to keep it short, as short as possible, if I could kindly ask that. And next, we're going to go to the European Public Health Association, EUFA, and to their president, Dr. Iveta Nagyova. Dr. Nagyova.
Yes, can you hear me, please?
We can. Please go ahead.
Thank you very much. Good afternoon. Dear Dr. Hans Kluge, dear WHO colleagues, dear NSA representatives, we appreciate very much being invited to participate in this important virtual briefing on the European Programme of Work. EUFA, or the European Public Health Association, is the largest network of public health professionals in Europe. It brings together 78 national public health associations and institutes from 47 countries. We welcome the European Programme of Work, and we are impressed with the plans for the near future, which fit perfectly well in the new EUFA strategy for years 2020 and 2025. The determination to leave no one behind is exactly what EUFA stands for as well. As you stated, leadership capabilities of health and more particular public health professionals need to be reinforced, and information deficit disorders need to be tackled. You also are looking for strong partnership in data collection and analysis. And we see our role in supporting the WHO Europe in these tasks in continuing our capacity building activities, as well as providing the evidence base, including effective translation of evidence into action. In our AAA strategy, analysis, advocacy, and action are key. The analysis is the basis, followed by advocacy to get our message through, and by action to make this happen. The EUFA strategy can be seen as fully supportive of the European Programme of Work. In accordance with this, today I would like to highlight 3 areas in particular, or 3 points. Firstly, we will continue our collaboration with the WHO Europe, the European Observatory, as well as the European Commission on data collection and analysis through both the European Journal of Public Health as well as the European Conference, Public Health Conference. Secondly, together with other European partners, including the EU for Health Alliance, we will continue to advocate to inform policymakers, decision makers, and public health practitioners on possible actions to be taken, whereby we will deliberately be collaborative and supportive, and we will include a wide range of stakeholders directly or remotely touching upon health. And thirdly, we will organize actions to be taken with other members, other partners, and individual public health professionals. The European Public Health Week, in which the WHO is an active partner, is a very good example of such action or such activity. We are also welcome the WHO Europe's plan to strengthen the country offices, and we look forward to more interaction between our national public health associations and the country offices for regional and national collaboration. Finally, through our involvement in the coalition of partners, we have had the pleasure of participating in the WHO Europe's willingness to be creative and proactive, and we look forward to continuing our brainstorming sessions and actions here. Together, I'm fully convinced that we can reinforce all your efforts and all your flagships and any other activity under the European Programme of Work. And if I may, I also have a question or a comment. With regard to question, we are very much impressed with all the 4 flagship initiatives, which are very innovative and very up to date. And we see a lot of space for possible collaboration in all areas. However, today I would like to tackle upon the initiative on healthier choices incorporating behavioral insights. This initiative is strongly promoting the exchange of knowledge between the disciplines, moving out of the silos, transdisciplinary and intersectorial collaboration, which are very important for successful implementation of the SDGs. And this initiative or flagship is very close also to the UFA, because in the UFA DNA is it to encourage to a multidisciplinary approach to health, an example of which can be, for example, that the UFA section presidents have their educational background not only in medicine or public health, but also law, education, architecture, sociology, or psychology. In line with this, our question relates to specific short-term actions to be taken by the WHO Europe. And also I have a suggestion regarding the European Programme of Work, or we have a suggestion. Within this field, the capacity building is very important. Public health professionals need to be informed about the principles of behavior change and behavioral insights, because very often they are not aware of them. And secondly, the principles of behavior change can be successfully, or behavior insight can be successfully implemented also in knowledge translation when dealing with politicians or policymakers, resulting into effective evidence-informed policymaking. Thank you.
Thank you very much indeed, Dr. Nagyova. So I'm going to move straight on, if I may, before we come to the points you've raised, to Professor Frank Ulrich Montgomery, who's President of the Standing Committee of the European Doctors, CPME.
Well, thank you very much for giving me the opportunity to talk to you. On the CPME is the Committee of European Doctors. We represent medical organizations over the whole of Europe and the European Economic Area. And I would like to congratulate you to this program, EPW, which is a good translation of the general program of work into the specific European desires and needs which we have on this continent. In the background, or before the background of COVID-19, I would simply like to highlight 2 specific issues which are on the core DNA of CPME, and these will be health workforce, of course, and our desire for vaccinations. Let me start with the health workforce issue. We have seen, not only in the nursing and midwifery area, but also in the medical area, a tremendous burnout of personnel in the COVID-19 crisis. And we think, and we've asked for this several times, that we need a review of health workforce planning at national level, which not only considers baseline capacities, but which also is sufficient to ensure universal health coverage and surge capacities. Because when the second wave comes, which we hope all will not come, we will have a great problem in staffing and in health workforce, not only on the medical side, not only on the physician side, also on nurses and midwifery. And I think we have the time to prepare for that. Therefore, we very much welcome the EPW's commitment to continuing action and support of this process. Our second big issue is vaccination. I think we all have to put more effort into vaccination. We have seen how deadly and dreadful a disease can be if there is no vaccination around to help people prevent this. Vaccinations are still the best preventive measure we have at hand in medicine. So I think it is really adamant that we all together build up a structure to inform public about vaccinations, and we have to take up the fight with all these anti-vaxxers. I think we have to be very, very quick and fast on that. And maybe the health literacy initiatives of your program can also be of help if they boil down to a more practical approach to inform people about the truth about vaccination and also the lies of anti-vaxxers. The final point which I would really like to point out is what structure, and I would put that into a question in the interest of time, what structure do you think is needed to ensure that the multitude of health policy actors, member states, health stakeholders, the European Union, OECD, and WHO or Europe can align their agendas to avoid duplication and deliver concrete results? Because being active on many levels of health policy, I sometimes have the feeling we are a little bit redundant and we do duplicate our efforts instead of putting them together and joining them up. So my question would be, do you have a structure in mind to prevent duplication and redundancy? Thank you very much.
Thank you very much, Professor Montgomery, and we'll come back to that very straightforward question in a moment. I've just got one more intervention, and then we'll go to the panelists. And last but not least, Ms. Leah Wapner, who's the Secretary General of EFMA, the European Forum of Medical Associations. Ms. Wapner, please, the floor is yours.
Thank you very much. It's really very important for us to have this meeting, and I would like to, on behalf of the European Forum of Medical Association, thank you all for this opportunity to present in this virtual meeting. I would also like to thank our new regional director, Dr. Hans-Claude Blug, for his extremely descriptive and clear plan for the future. I was just told that my video is off. I don't know if you can hear me.
Can hear you, yes, please go ahead.
Okay, very good. So as I said, I would also like to thank our new regional director for his very descriptive and clear plan, and I think it's full of enthusiasm, and that is something which I think that we need today. We need leadership, and we need governance and medical governance, and I think we need that people should trust us and trust that we are handling the situation the best we can. And at this point, I would like to say that EFMA represents physicians, national medical associations, orders, societies throughout Europe, but with a particular emphasis with Eastern and Central Europe. And I think that your message to not leave anyone behind is very important for our members. Unfortunately, the world was not prepared for COVID-19. And at this unprecedented time of uncertainty, it is clear that we're all working on a very steep learning curve. And that's why this meeting is so important for us. The members of EFMA view the role of the physician to be of central importance in our health systems. but it is especially important as we are having several roles in this particular fight. First of all, our physicians need to treat the patients suffering from COVID-19. In addition, they also need to maintain the normal health service and ensure that all other patients are kept safe and cared for. Finally, we believe that physicians should promote public health messages to the general population, as they can do and they do in the vaccine and healthy lifestyle. It is imperative to ensure that the health professionals are kept engaged, informed, and protected. In order to meet the challenges of COVID-19, it is clear that we need joint effort between governments, non-governmental organizations, society, and the public at large. One of the key components to achieve this is trust. And this appears an area that we can do better. We have seen that the current crisis, that information provided to the public is paramount in supporting public health efforts. We believe that health professionals, as they are still held in very high esteem, can be the gateway to get the current public health information out. We think that the most effective governments must work hand in hand with the profession and engage them in spreading the message. The current pandemic is a global issue, not only a regional. And then we think that we need to have reliable, accurate, and cohesive information data that all states can bring together and will help to the solidarity of the message. This is also important for us to share what we don't know, what we still need to work on, what is still uncertain. I think that this will enhance the trust of the population. We believe that WHO is in a unique position to bring together the governments and to send out this cohesive message that the communication might be better, and if we engage the governments to bring the information to the professionals promptly and as much cohesive as possible, we think that the key message will go out to the public and they will actually hear it. It is beneficial also to lead different governments to have some standardization in the information, in the terminology, in the data, and even in the recommendations. This will allow a more coordinated and comprehensive approach to the communication. There is great diversity and disparity between the different countries, as was said before. The European region has, we welcome their plan of not leaving anyone behind. We know that there are different health systems. We realize that there are different efforts, different capacities in this emergency and in others. And we think that this is the most important flagship, and we would be more than happy to help in this area. Finally, in order to allow our health professionals to work most effectively, we need to ensure that we keep them safe. Failures of many governments to provide required personal protective equipment, or at least the feeling of the physicians that they did not receive the accurate personal protective equipment, cannot be repeated. We need to care for our carers, not only those who are working in the front lines, but in all areas of the healthcare. In addition, the increasing number of cases of burnout, as was highlighted by my colleague before, is a very deep concern. We there feel that the flagship of mental health is extremely important, and here, once again, we'd be more than happy to help and to do our part in this. If it's possible, I would just like to raise one question, and that is, we would really like to know how WHO plans to get accurate, reliable, and coherent information out to the health workforce. Thank you very much.
Thank you very much, Ms. Wapner. So I'm going to very briefly try and respond to some of those. So Dr. Nagyova from UFA, we will reach out bilaterally on behavioral insights, very much welcoming that support. And we need to give you a description of that flagship, because I think this has great promise, this partnership. In terms of Professor Montgomery and the work and alignment of the different actors, I'm going to go across to Ms. Oksana Domenti, the WHO representative to the European Union, to respond to a little bit about how we work alongside the EU. Oksana, please.
Thank you, Rob. And thank you all for questions related to our partnership with the European Union and between us in the European Union framework, between WHO and non-state actors. And let me welcome this opportunity in the context of EPW consultations to engage with non-state actors and to thank our partners for their activity and our previous fruitful cooperation. And now there are many actors online which we have very fruitful cooperation in the past. And I'm looking forward for our future cooperation. You know, probably the role of Brussels office in the European Union is to facilitate the cooperation between the European Union, which is one of our key strategic partners and donors, and WHO across Europe, but also globally, and to advocate in the European Union for a health as co-priority for sustainable development. And our cooperation with the European Union is framed with a series of agreements which cover almost all strategic areas of and priorities of EPW. I'll not mention here, but almost all of them are covered by our agreements. And our partnership with the European Union becomes operational through several strategic and technical activities, meetings, joint activities, and joint projects. You know that the European Union is not a specific health organization, but health is becoming part of its mandate more and more, and the European Union role in global health is increasing. And we welcome the Commission commitment to increase attention to the sector, the announcement of the new special EU for Health program, and other related initiatives and increased investment under the new MFF. Currently, following the pandemic and the new European Union impetus for health cooperation, our regional office and our Brussels office in the EU is actively engaging with the European Union to more actively to prioritize health across all policies and financial instruments, and in exchange on the key European health initiatives covering geographically, which is very important, both the European Union and non-European Union countries, especially Western Balkans, Eastern Partnership, Central Asia, if we are speaking about our region. And WHO is organizing similar consultations with the Commission on the EPW to reflect on our respective priorities, to identify synergies, and we are in the consultations with the European Union member state, with the European delegations, with non-state actors, with you, in order to ensure the coordinations and to ensure a synergy. Our cooperation with non-state actors, so we must work together. It has a core activity of both WHO and the European Union of linking with the civil society in all its aspects. So linking with non-state actors is therefore at the crossroads of WHO and the European Union in the European region. We must work together to pool our efforts, to coordinate and to ensure a coherent approach and promoting better health across the region and to maximize our effect. And the European Union office plans is to continue to organize dedicated meetings with non-governmental organizations based in Brussels to inform each other, to exchange views, and to discuss potential joint events and activities. Thank you.
Thank you very much, Oksana. Right, very quickly, I'm Dorrit with 30 seconds. Can you also respond to the point that Ms. Wapner made from EFMA, the Secretary General?
Okay, so very short. I couldn't agree with you more, Leah. And indeed, everything you touched, so we need to work and we continue working on getting the health workforce ready, informed, engaged, protected, and of course, trusted. One of the things that I just wanted to add here, we are also, and I'm not sure that everybody knows, we are monitoring on daily basis the attacks on healthcare and healthcare workers, as well as doing the work now to standardize the morbidity and mortality of impact on healthcare workers of the COVID-19. So making sure that all data are collected in a harmonized way so that we can share with you. And Ms. Wapner, we are ready to continue working together. It's always a pleasure. Thank you.
Thanks very much. Okay, so we had an hour and a half. We needed a day and a half. That's clear. We also had a number of questions from the International Council on Nurses, Healthcare Without Harm. We had questions from WEMOS, also from EFPC, European Federation of Neurological Associations, International Pharmaceutical Students, and the Association for Medical Education in Europe, amongst others, online on Slido. We will respond to those in writing, we can assure you, and we will be engaging with you, of course, as we take the EPW forward. But on this note, I'm just going to hand over to the Regional Director to make a few closing comments. Thank you.
Thank you, dear colleagues, for this tremendously interactive and rich session for us. Kind of a first time for WHO Europe, definitely for me. So I would like to make it a tradition, hopefully also once more in person. Your support is tremendously important to really leave no one behind, because I saw this also during my career, having been served in many countries, that there is no antagonism over there. It's really a complementarity, and you have, health workforce, patients, civil society, you know what is the real truth on the ground. And unless WHO knows this, we cannot make a policy which will impact real people's lives. So that's, again, my invitation also to send comments, further comments on the EPW. I wish very much you to follow the WHO Regional Committee for Europe, where the Ministers of Health of over 53 member states come together to steer the work of WHO Europe. This will be live streamed on 14 September 2020, and most likely this will be indeed virtually. I also invite regional non-state actors to apply for accreditation to the Region Committee so that you can attend our Region Committee meetings and engage directly with member states. Do not hesitate to contact Rob to guide you to the information on the website. The next deadline is end of the year, and definitely I would like to see many more of you. There is many important groups. Rob mentioned some of those who came in. As many of you know, I was also with the Ministry of Health of Kazakhstan and UNICEF behind the Astana conference for the 45th anniversary of the Alma-Ata conference. And we made the commitment, the global commitment there, to involve also the youth from the very beginning. So in that sense, I'm also reaching out to the youth very much to go forward together and involve them. I wish everyone to remain positive, to remain connected in these tough times, and to remain with a strong health. Thank you so much. Spasiba vam bolshoye, and see you again.